How to deal with your child's separation anxiety. Separation anxiety from a parent is a stressful time for any child, just as much for parents, who may be experiencing the same for their child. This is healthy for young children and is something they will eventually come to accept and grow out of, but how do you cope in the meantime? Here are a few tips. Try to look at it from your child's point of view. At their age, around 3 to 4 years, they are still very self-aware, and you, the parent, are seen as their source of everything: food, warmth, love, affection, authority, reassurance, safety. They see you going as you going for good. Therefore it is imperative that you realize that this is genuinely stressful for them, even though to you, there should be no issue. Let them know what will happen. Explain in direct language what will happen. Do this several times, if possible, and be sure to do it just before heading out or the arrival of the sitter. Emphasize the fun things he or she will do. Interact with the caregiver a while before separation. It's important that your child sees you're okay with the person he or she is with. A few calm minutes getting your child interested in a toy, game, or activity can really help separation. Don't, however, drag this out. Be supportive and calm. You must be supportive through this time and reiterate to them that you are always there for them. Be loving and calm, and you shouldn't go far wrong. Don't feed into the drama. You may do everything right, but it's still hard for your angel to say goodbye. Be calm, firm, and loving. Do not prolong separation, even though your child may very well seem inconsolable, throw a temper tantrum, and beg plaintively to come with you. You may have to have the caregiver restrain your child, gently and lovingly, of course. It's natural to be concerned that your child is miserable. Call in 10-20 minutes to check in if you need to. Chances are, your child has come about and doing fine. If you are away for a longer period of time, keep in contact with them, call them while you are away and reassure them that you will be back soon. Vary the topics: how their day was, what they did, funny anecdotes. This all helps to keep their mind away from the separation anxiety. Leave them lots of activities to do during the day. Set up some paints, coloring books, a kids' DVD/TV program, something fun to keep them occupied. Again, this will help distract them from the fact that you're not there. When you get back, greet them with all the love and hugs and kisses you can muster. Praise them for being so good while you were away, and then spend some quality time with them. All these, with repetition, will help them understand that you are always there for them and will always return to them. Facts about separation anxiety. Infants, separation anxiety develops after a child gains an understanding of object permanence. Once your infant realizes you're really gone, when you are, it may leave him unsettled. Although some babies display object permanence and separation anxiety as early as 4 to 5 months of age, most develop more robust separation anxiety at around 9 months. The leave-taking can be worse if your infant is hungry, tired, or not feeling well. Keep transitions short and routine if it's a tough day. Toddlers. Many toddlers skip separation anxiety in infancy and start demonstrating challenges at 15 or 18 months of age. Separations are more difficult when children are hungry, tired, or sick, which is most of toddlerhood. As children develop independence during toddlerhood, they may become even more aware of separations. Their behaviors at separations will be loud, tearful, and difficult to stop. Preschoolers, by the time children are 3 years of age, most clearly understand the effect their anxiety or pleas at separation have on us. It doesn't mean they aren't stressed, but they certainly are vying for a change. Be consistent, don't return to the room based on a child's plea, and certainly don't cancel plans based on separation anxiety. Your ongoing consistency, explanations, and diligence to return when you say you will are tantamount. How to survive separation anxiety. Create quick goodbye rituals. Even if you have to do Major League Baseball-style hand movements, Give triple kisses at the cubby, or provide a special blanket or toy as you leave. Keep the goodbye short and sweet. If you linger, the transition time does too. So will the anxiety. Be consistent. Try to do the same drop-off with the same ritual at the same time each day you separate to avoid unexpected factors whenever you can. A routine can diminish the heartache and will allow your child to simultaneously build trust in her independence and in you. Attention. When separating, give your child full attention, be loving, and provide affection. Then say goodbye quickly despite her antics or cries for you to stay. Keep your promise. You'll build trust and independence as your child becomes confident in her ability to be without you when you stick to your promise of return. Age-inappropriate clinginess or tantrums. Constant complaints of physical sickness. Withdrawal from friends, family, or peers. Refusing to go to school for weeks. Preoccupation with intense fear or guilt. Excessive fear of leaving the house. Treatment for separation anxiety disorder in children. Specialists can address physical symptoms, identify anxious thoughts, help your child develop coping strategies, and foster problem solving. Professional treatment for separation anxiety disorder may include talk therapy. Talk therapy provides a safe place for your child to express his or her feelings. Having someone to listen empathetically and guide your child toward understanding his or her anxiety can be powerful treatment. Play therapy. The therapeutic use of play is a common and effective way to get kids talking about their feelings. Counseling for the family. Family counseling can help your child counteract the thoughts that fuel his or her anxiety, while you as the parent can help your child learn coping skills. School-based counseling. This can help a child with separation anxiety disorder explore the social, behavioral, and academic demands of school. Medication. Medications may be used to treat severe cases of separation anxiety disorder. It should be used only in conjunction with other therapy.